Welcome to Week 1 of Foundations of Community Health Nursing. Today we're going to explore what community health nursing is, why it matters, and how you, as future nurses, play a vital role in supporting individuals, families, and entire communities. This is the beginning of seeing nursing through a wider and more meaningful lens. By the end of today's lesson, you'll be able to describe what community health nursing is, how it differs from traditional bedside care, and how public health frameworks guide our work. You'll also understand the levels of prevention, the social determinants of health, and key nursing roles in the community. We will wrap up with some practice questions so you can connect everything together. Community health nursing is population-focused and prevention-oriented. Instead of caring for one patient at a time, CHN looks at patterns, the needs of groups, neighborhoods, and communities. We examine what puts people at risk, what promotes wellness, and how we can prevent problems before they begin. Think of community health nursing as expanding your nursing lens outward, from the individual to the community around them. In community health, we don't just treat symptoms, we look upstream to understand what's causing them. Upstream thinking means asking, what is the root cause? What's happening earlier in the chain that leads to illness today? Systems thinking takes that even further. It reminds us that health is influenced by policies, structures, resources, and environments. Both perspectives help us design long-term, sustainable solutions that support whole communities. Individual-focused care is what we're familiar with: one client, one plan, one set of needs. But population-focused care looks at the bigger picture. What trends do we see? What problems are affecting many people at once? When we shift to a population perspective, we move from simply treating illness to preventing it and promoting long-term wellness. These three approaches sound similar, but each has a unique purpose. Community-based nursing is individual care in the community, like home health or clinic visits. Community-oriented nursing is focused on improving the health of groups, often through education, programs, or outreach. Public health nursing works at a system level: surveillance, policy, and community-wide disease prevention. Together, these approaches allow nurses to care for both individuals and whole populations. Public health practice is guided by three core functions: assessment, understanding what's happening in a community by collecting and interpreting data; policy development, using that information to guide decisions and create programs; and assurance, making sure the services and resources people need are actually accessible and effective. Nursing plays a role in all three levels of prevention. Primary prevention focuses on stopping problems before they start, like vaccinations and education. Secondary prevention involves early detection, screenings, testing, and case finding. Tertiary prevention helps people manage existing conditions and prevent complications. Remember, community health is rooted in prevention, not just treatment. Healthy People 2030 gives us national goals for improving health. It highlights the most urgent needs in the United States and outlines achievable targets to improve the well-being of communities. As nurses, we use these goals to guide our education, our advocacy, and our care planning. The social determinants of health are the conditions in which people live, learn, work, and grow. These 5 domains: economic stability, education access, healthcare access, neighborhood and built environment, and social and community context, influence up to 80% of health outcomes. Understanding SDOH helps us see the full picture of a person's health. Social connection is more powerful than we often realize. Belonging, support, and strong relationships can improve mental and physical health, increase resilience, and reduce stress. In community health nursing, we look for ways to strengthen those connections because they have a profound impact on wellness. As community health nurses, our responsibilities reach beyond clinical tasks. We assess SDOH, screen for unmet needs, provide education, connect clients to resources, and advocate for equitable care. Community health nursing blends teaching, support, prevention, and empowerment. To care for diverse communities, we must practice cultural competence with humility and respect. We increase awareness, build knowledge, strengthen communication skills, and engage with clients from different backgrounds. Remember, effective care requires curiosity, openness, and the use of qualified interpreters when needed. Our goal is always equitable, person-centered care. Implicit bias affects how we interpret information, communicate, and make decisions, often without realizing it. Structural factors, like housing, transportation, education, and policy, also shape health outcomes. By acknowledging these influences, we can work toward health equity and provide fair, respectful care to every client. Community health nurses can be found in schools, community centers, health departments, home health, long-term care, shelters, and many more settings. Each location offers a unique opportunity to support wellness and remove barriers to care. In the community, the RN wears many hats. We are educators who teach individuals and families. We are advocates who speak up for client needs and fairness. We are collaborators who work with teams and organizations. And we are care coordinators who help clients navigate services and stay connected to the resources they need. Safety looks different in community settings than in hospitals. We consider our surroundings, maintain awareness, ensure safe pathways, follow agency protocols, and always prioritize our well-being. A safe nurse is an effective nurse. Population health focuses on improving outcomes for groups of people, not just individuals. We look at patterns, risk factors, and disparities. We collaborate with the community to promote wellness and reduce harm. And we think upstream, addressing root causes, not just reacting to symptoms. Quick check. Levels of prevention. A community health nurse provides flu vaccines at a community center. Which level of prevention is this? Primary prevention aims to stop disease before it occurs. Vaccination prevents influenza infection, making it a primary preventive activity. Incorrect options. Secondary. Focuses on early detection, e.g., screenings, not prevention. Tertiary. Focuses on reducing complications of an existing disease. Health promotion. Broad concept, vaccines fit specifically under primary prevention. Quick check. SDOH. A client lacks transportation to appointments. Which SDOH is most directly involved? Transportation access is part of the built environment, which includes infrastructure, housing, transportation systems, and environmental design. Incorrect options. Economic stability. Involves income, employment, and financial resources, not transportation. Social and community context. Refers to support systems, discrimination, and relationships, not transit. Education access. Refers to quality schooling and educational opportunities. Quick check. RN role. A nurse collaborates with school leaders and a mental health counselor to start an after-school program. Which RN role is demonstrated? Collaborators work with teams, organizations, and community partners to achieve shared health goals. The nurse is coordinating efforts with school staff and mental health professionals. This is interprofessional collaboration. Incorrect options. Advocate. Involves speaking up for client rights or needed resources. Educator. Focuses on teaching individuals or groups. Care coordinator. Involves linking clients to services or managing referrals, not community program creation. A clinic notices higher rates of uncontrolled diabetes in one neighborhood and launches a mobile health van in that area. This intervention represents launching a mobile clinic in a high-need area is an example of health equity, because it increases access to care for a disadvantaged population and seeks to reduce disparities in chronic disease outcomes. Incorrect options. Cultural competence. Involves adapting care to cultural needs, not access expansion. Primary prevention. Would involve preventing diabetes. This intervention helps those who already have it. Case management. Focuses on individualized coordination of services, not a community-wide outreach program. Today we explored the foundations of community health nursing, including prevention, SDOH, public health functions, cultural competence, and the role of the nurse in the community. All of these pieces come together to help us support healthier individuals and healthier communities. As we close, take a moment to reflect. What strengths and challenges do you notice in your own community? How might a community health nurse make a difference there? These insights will help guide your learning throughout the course.